Going into details of the skull except the occipital condyle. This is the occipital bone and this is the occipital condyles. The two occipital condyles have to move on the superior articular facets of the first vertebra. So here they are like this. Okay, so this is the very explanatory picture for occipital bone with external, come join me here, external, these are the occipital condyles, and on the occipital condyles we have joint with, so this is the first joint between skull and the first vertebra. This is atlas, this is occipital, so atlanto-occipital joint, as I told you. So this is the first thing in the market. Then we have the second. Second is very special because it has an odontoid process. This is the superior surface. Okay, so this is the arch, and we call this as lateral masses, lateral mass, because we don't have very clear cut of them. So this is called lateral masses of this atlas, this is axis. It odontoid process. So this is atypical. Why atypical? Because no body, no spine. Here we don't have any body, or some books say the body is having a upward projection called odontoid process. So this is like the body and odontoid process. There is no disc between this and this one because there is no body here. After this, yes, we have bodies and we can have discs like here. So this is the formation of disc. Of course, there should be discs after 1 and 2, intervertebral discs. This is second vertebra, and this is of course again atypical. When I say atypical, it means it has a different shape than the typical ones. You can see all of them, they look like same. 3, 4, 5 and 6. What is the typical feature of any typical cervical vertebra? We have a body, then we have lateral masses, and we have foramen transversarum. Then we have intervertebral canal or vertebral foramen. Then we have lateral mass. We have spine, which is bifid, which is just to give more attachment to ligamentum nuclei. The C7 is again atypical. When I say atypical, there are features like it is more looking like towards the thoracic. This is a very typical thoracic. So this is more like it has a very long spine as compared to all of them. Plus the spine is straight and not bifid. Like, and after this is the C7. So this is the phase where we are going from cervical towards the thoracic. And then in the thoracic region, you know, you have done with the thoracic vertebra, you know, the small body with strong lamina and the spine is facing downward. This is a typical thoracic. After thoracic, we have lumbar. Lumbars have to support the body weight because the spinal, this vertebral canal has to hang and transmit the weight of the body. So they have a very strong, big bodies. And then they have a canal. Of course, they don't have any other, don't have foramen transversarum except the cervical. All cervical will have foramen transversarum. Then we have superior and inferior articular facets. Here we can at least see them because they are very small. This is easy to see. Here is superior articular facet and here is inferior articular facet. So these inferior will join with superior here and make the zygopophyseal joint. Okay. Between the two bodies we have, here we have a thin layer of hyaline cartilage, here we have a thin layer of hyaline cartilage, and then in between we have intervertebral disc. Then we have anterior longitudinal ligament which will run here. Then we have posterior longitudinal ligament which should run on the back of the body here, not here, back of the body. Then between the two spines, on the tip we have supraspinous. In between we have interspinous. Between the two transverse we have intertransverse. And connecting the two conjunctive, this what is called lamina. This is a lamina, this is a lamina, and the lamina are connected with ligamentum flavum. So these are the distribution of some ligaments in the vertebral canal. Except the first two, We have said anterior membrane, atlanto-occipital membrane, posterior atlanto-occipital membrane, and it is of course here like covering the front and covering on the back. Anterior and posterior atlanto-occipital membrane like this. Then, is it clear?
Yes.
Okay. This is the cervical spine. When I say cervical spine, I have to concentrate on the transverse foramen transverse serum in the transverse processes. These are 1, 2, 3, 4, 5. This is C7 with the longest spine and which is not bifid. All of them, they are bifid. The first and second are not shown here in this picture. So first and second is like here and here. Okay, odontoid process is a demarcating point for second. Then we have the movements, sliding movements can occur, and this is mostly occurring on the vertebral bodies like this. These are the sliding movements. And with the help of sliding movements like this, like this, like this, like this, like this, we can turn around in the cervical and in the lumbar region. Good? Yes. This is again the body. Then anterior longitudinal ligament is visible. The posterior should be here. It is mostly occupied here in this case by vertebral, the spinal cord and the duro mater and others. So we cannot see other ligaments, except we can see the supraspinous. We can see the interspinous. Here should be the intertransverse between the transverse process. The transverse process, it should be intertransverse. And between the lamina, we should have here flabum, ligament of flabum. This is showing you all the cervical along with the atlanto-occipital joint. So this is the occipital bone, the two occipital condyles making joint with the first one at here the lateral masses, superior articular facets, and this is called superior atlanto. And I told you the odontoid process here. This is the first one. So odontoid process is here. Maybe suppose this is the odontoid process. Suppose if this is fractured, so it is going to damage the initial most part of the brainstem or the spinal cord or the lower part of medulla. So it can cause you respiratory arrest. So here are the bodies of the cervical vertebra. In the foramen transverse serum, you can see the vertebral artery, and it is going here inside the skull to give you blood supply of the brain. You know circle of Willis now. Nothing special here. I don't have any ligaments, just to show you the size and shape of the lumbar vertebra, but it is more obvious here. Lumbar vertebra, big bodies and strong, and the spines are not going down like in the thoracic. The spines are going vertically back, and most of them, they are quadrangular spines, not very triangular, most of them. In the thoracic, we have spine thin, long, and it's going down. Here is the full description of your vertebral column. You can see the cervical with atlas. You can see the joint, the first one, atlantoaxial joint, and then you can see the joints between the bodies in the form of intervertebral disc. You can see joints, the zygopophyseal joint very nicely, for example here, for example here, for example here. So this is the joint between the superior and inferior articular facets. They are called zygopophyseal lateral articulations, or the joints between. You can see the spines, and this is the, like, you can find the spine, and if you have a spine like not straight, it's scoliotic, maybe C shape or S shape, this is scoliotic spine. Then some of the pathologies of the disc, like here, you can see some herniation of the disc because it is after the fracture or damage to the outer circular part of the disc, the annulus fibrosus, and the nucleus may leak out, and it can damage, if it is extreme in the center, it can damage the spinal cord, or if it is on the periphery, it may damage the spinal nerve. Thank you.